Welcome to afternoon 2 of Big Data Future. Again, I want to thank all of our participants and you for joining us. I also want to thank, again, the real nuts and bolts organizers, Julie Keys and Kelsey Chandler Nelson. Yes. The one thing I will acknowledge that I did not ask them to think about, and nobody else on the planning committee thought about, is we actually didn't give you a way, and this is ironic given all the discussion of structured data, we didn't give you a form on which you could tell us how much you liked the conference. And now that I know from informal comments that you did like the conference, I'm really regretting that. What I would just like to encourage you to do is to sort of share your sentiments, and there are lots of ways to do that, obviously, but if you tweet your sentiments, you could just use hashtag BigDataFuture as one word. That's how we've been doing it. I'm Shane.29 at osu.edu, and again, all feedback is gratefully received, including ideas for follow-up activity or anything else you think we should be doing. But please, we would be delighted to know your thoughts. And if they're complimentary, share them with others. So this afternoon's kickoff panel is Big Data and the Social Good, which I subtitled Health, Education, and Welfare, mainly in deference to what used to be the Cabinet Department of Health, Education, and Welfare. Like all of our panels, it probably deserves a conference or a university degree program of its own. Again, because of the extensive biographies that exist for our panelists, both in the program and online, I'll just introduce them again very briefly, just in the order in which they'll speak. Michael Johnson holds a PhD in operations research. He's now associate professor in the Department of Public Policy and Public Affairs at UMass Boston. His research aims to enable nonprofit and public organizations, especially those serving disadvantaged and vulnerable populations, to develop more efficient, beneficial, and equitable programs and policies. He will be followed by Nick Mader, who is a senior researcher at Chapin Hall at the University of Chicago. Nick is the principal investigator for the Chapin Hall Collaborative of Youth Support Service Providers, a project that well illustrates his focus on improving outcomes for at-risk youth and guiding policy using administrative data on city populations, using advanced statistical methods, and using close cooperation with city agencies and nonprofit service providers. And batting cleanup will be Scott Burris, who sits next to me. He's a professor of law and public health at Temple University, where he directs the Center for Health Law Policy and Practice and the Robert Wood Johnson Foundation's Public Health Law Research Program. He's an incredibly prolific writer, his work focusing on how law influences public health and what interventions can make laws and law enforcement practices healthier in their effects. So this will actually be the Department of Welfare, Education, and Health. And we'll start with Michael.
Okay. Well, thank you, Peter, and good afternoon. I'd like to say just a note about why someone with an operations research training is on a panel of big data for public good, and that's because a lot of people in my field tend to gravitate to or do more teaching and research and information technology, because that's the way that operations research solutions, helping organizations make better decisions, are usually implemented. And I've been doing public sector OR my entire academic career, so it was only natural that I do a little bit of information technology as well. So my talk is focused on community-based organizations and transforming data to decisions for community development. So the research question that motivates this talk is, well, the more I think about it, it's pretty similar to the one that I ask in many other aspects of my work on decision modeling for housing and community development. But here the focus is more on the data that organizations need to make better decisions, whether that data are big or not. And the overarching question is, how can community-based organizations create information and make decisions to better fulfill their missions? So many of the examples in this talk are drawn from Boston, where I work. And there may be lots of similar examples in cities where you live, and so I'm not going to make any effort to be comprehensive or exhaustive in this presentation. And for all the questions that I've listed on the slide, an important contrast that I may not always make explicit is that between community-based organizations, which I'll define, and other organizations, larger nonprofits, government, and for-profit organizations. So these are the topics that I'm going to touch on in the talk, starting from positioning community-based organizations in the landscape of users of data and analytics, and ending with a research agenda that reflects some small field research that I've already done and that I hope to do a lot more of. So grassroots organizations, community-based organizations, I don't know if there's an official definition of it, but the Boston Foundation has done a survey of the nonprofit sector. There are lots of taxonomies of that, and I'm not going to really attempt it here, but the Boston Foundation defines grassroots organizations as nonprofits that have low expenses, less than $250,000, sometimes zero, and they define safety net organizations as those with budgets between $250,000 and $50 million. So I think of community-based organizations as those with budgets of $2 million or less. They tend to make up a large share of the organizations that file these public charity tax forms. They have relatively low expenses compared to regional nonprofits in health, education, and regional development. And they make up a relatively or disproportionately small fraction of economic activity in the nonprofit organization sector. So their constituents are usually defined by neighborhoods or regions, or they may be defined by social groups, immigrant status, and they tend to specialize in community development, human services, and advocacy. We've seen different definitions of big data, and the two that I have here are mainly to contrast the experience of community-based organizations who face special constraints of knowledge and capacity and operating environment with other organizations. Unlike the private sector, multiple performance metrics, some that are not measured and some that may not be measurable now, they can impede access to comprehensive databases. And these organizations also face mandates from funders regarding data collection that may not fit their own needs. In other words, to get this grant, we need this number, and no one knows where this number is. For smaller and resource-constrained community-based organizations, big data may mean something that's larger than a spreadsheet of a few hundred rows, and the technology to make sense of big data could be limited to office productivity tools, and maybe of those, just a spreadsheet and a web browser. Some of us may be personally familiar with the IT resource constraints that NPOs face, and these are only more challenging for the smaller and mission-driven community-based nonprofits. And so many of you may be familiar with the notion of a brain drain or a CBO that has somebody's cousin or friend who's really the IT manager. So we can summarize the characteristics of CBOs with respect to data and analytics along these four dimensions: the size of the data, the type of mission-driven, the nature of the technology, which we hope is appropriate and as opposed to big, and the capacity to apply theory to practice, which is relatively low for CBOs along these different dimensions. So I'm going to, we can see here that CBOs can derive benefits from data and analytic tools that are very different from other organizations, in particular for-profit organizations. It may be that for CBOs, the richest contribution they can get from the data that they have or the data that they can make available to them is better understanding of their mission, of the communities they serve, of their capabilities, and the story that they wish to tell to the world. I sometimes have in my mind the social worker notion, and no offense to social workers, if I can, change one life or save one life, I've done good. And that's a great place to start, but the message I've been getting is that CBOs need to do more than that. They have to tell a more comprehensive story, and perhaps big data can do that. So I'm going to transition now to discuss a range of data and technologies that can meet the needs of community-based nonprofits. And I'll have time to discuss only some of these. We'll start with what I call visualization applications. These are mostly maps, and I call them visualization because the purpose is really to present large volumes of data in intuitive ways. And the first thing, and some of these technologies may be familiar to some of you. So Policy Map is developed by the Reinvestment Fund, and they say, I didn't count them all up, they say they provide access to 15,000 data sets, including demographics, housing, lending, consumer spending, et cetera. The map displays are customizable. They are really nice, and they allow you to superimpose up to 3 different data sets. This is a pretty useful one. Another application that is local to Boston, and I don't know if it exists elsewhere, is called My Neighborhood Census Viewer. It's developed by a local researcher and made available by the Boston Redevelopment Authority. And the idea here is that on the web, we have census block data. That's the smallest unit of aggregation, and the technology allows a user with a mouse to define their own neighborhood that may not correspond to official boundaries, and the software will collect data from the blocks that are contained within the shape the user draws, and you get to define your own neighborhood, and then it computes demographics based on those. And this helps, is especially relevant to CBOs that may serve constituencies who don't define themselves by city neighborhood X or city neighborhood Y. Boston Research Map uses My Neighborhood Census Viewer. It's connected to it. And this is developed by the Boston Area Research Initiative, which I'll say more about later, and the Center for Geographic Analysis at Harvard. And so this is a open, shareable spatial data repository, lots of user-contributed data, and it's an example of a larger initiative called World Map. That has similar user-contributed spatial data from all over the world, but this example is just for Boston. Weave is really more of a technology than an end-user application. It comes from University of Massachusetts Lowell, and it's an application development platform that supports multiple levels of users as well as the ability to integrate and analyze and visualize data. So what we have on the screen here is trends in obesity in the U.S. over time, at the bottom, left for you, over space, the map at the top, and population segments on the other side of the bottom panel. And so it's a key component of the Metro Boston Data Common that's developed by Boston's Metropolitan Area Planning Council, but it's been adopted by other organizations as well. Another category is what I call database-driven technologies. As well as maps. And so one example is the Boston Indicators Project. It's an initiative of the Boston Foundation, and its purpose is to identify and quantify goals and indicators and measures. American Fact Finder is a census product, and it's really just a new name for database queries, except now they're applied to diverse data sources, and you can also display the results in maps. Another example of a technology is what I call model-driven, and this slide represents a newer way of thinking about how to use data and analytic methods to solve problems whose characteristics that I think are especially representative of those faced by community-based organizations: multi-stakeholder, multi-data source, multi-understandings of the problem to be solved. So I'd like to talk now about some dimensions of performing analytics that I think are salient to community-based organizations: organizational characteristics, the nature of the inquiry, and data characteristics. So 2 approaches that I notice are centralized. Boston Area Research Initiative is an example of these. Researchers mostly from Harvard, working mostly with city agencies, working mostly with large administrative data sets, with really smart people to gather insights and design interesting implementations. The Urban Research-Based Action Network is really the polar opposite. Its goal is to enable researchers and community-based organizations to build collaborations, but not focus on particular projects. And I'm affiliated with the Boston node of Urban, and I think my talk is kind of inspired by the Urban model of building relationships first and projects second. Some of you may be familiar with Code for America. They have done hackathons across the country, and this is pretty decentralized as well. No one is telling the individual coders sort of what to do. I think the centralized approach is more visible and better funded and more influential. They do great work. I just happen to feel more comfortable with a more decentralized approach, and maybe that'll be evident if I'll have time to describe a sample project. We can think of approaches as being based on models, traditional social science and decision science, as opposed to data-based approaches, and the two fields are, they can be little at odds. The computer scientists think that the social scientists don't know what they're doing, that everything good can come from data mining. Analytics, as operations research defines it, really encompasses both approaches. CBOs have a deep understanding of local areas, and they tend to be interested in qualitative as well as quantitative data, primary data, and proprietary. No one else has it. That makes meeting their data needs pretty difficult. There are not many administrative data sources that reflect the reality that CBOs actually face. So how can we validate these insights through data from the field? Some propositions that I have up there may give us a little bit of understanding of what CBOs can and can't do with big data. And to answer these, I did some key informant interviews. And the themes for, that I found is that overall, there's not a lot of awareness of big data in analytics. They don't see it as a solution. They see that it's really hard to use data, hard to use applications. They want outcomes. They're asked for outputs. They don't have the time to get highly skilled. They don't necessarily know what the story is they want to tell, though they're interested in the idea of making better decisions. They don't have enough money. This looks pretty difficult. We've done some field observations of some data trainings, and we found that the applications are great, but they require a lot of understanding among CBO employees. It's really hard to make good use of these applications. And I'm embarrassed to say that for one of these trainings, I had trouble figuring out how to make it work, and I'm supposed to be someone who knows how to teach this stuff. So if you don't have a theory of change and appropriate training, a lot of these great applications that I talked about before may not be of good use to community-based organizations. I did a focus group with a community-based organization, and I found that they didn't know how to measure. They didn't know what data could capture the value that they added to the community. They didn't quite know how to measure it. They didn't know how to store it. They were dissatisfied with the IT application that the city made them use. They wanted to make better decisions but didn't know how. So it seems to me that there's an opportunity for data and analytics projects with CBOs that reflect community-based participatory action research. And that's one thing that I hope to do. So there's some support for these propositions and these assumptions. And I've devised some principles for applied research and community-focused data and analytics that hopefully will resonate with you, and I think they'll be a basis for the work that I do. And I would say that my research agenda going forward is to survey community practitioners to find out what data they know of and how they use their data, and participatory solution building, both for organizations and decision modeling. And I think that research agenda based on collaboration, appropriate technology, and shared resources could really move the community-based organization movement forward. And that's all I have. Thank you.
Great. Very excited to be able to share a couple of ideas with you. It's been a phenomenal conference. Thank you, Peter, for organizing, and Julie and Kelsey, wherever you are. So I think that so we had sorted out our order, and I think that this work that I want to be sharing with you is sort of a particular instantiation of one of these. I don't know if I'm coining the term, but public academic partnerships, and this is particular to the city of Chicago. And I'm going to give you kind of two parts. One is going to be socially driven, social policy relevant research as it happens today, and I'm going to kind of walk you through an example as kind of a model of how we are organizing work in Chicago. So the premise that I want to offer you is that the quality of decision making with social policy relies on good causal analysis. And causal analysis is of a very particular type. It's not the same as predictive analysis. As Eitan was describing yesterday, there is a particular premium on being able to get beyond correlation and into causation. And the type of policies that fall into this rubric is anything that can form something like, fall into the statement of policy change A will lead to result B with a level of confidence C. And to kind of phrase this policy change A, we need a good characterization of whatever policy regime we are currently facing, and then a well-defined proposal of how things will change, as well as the mechanism what carries forward from that. We'll all have our own particular definitions of big data. So for now, let me just say that innovations in data tracking, storage, and integration, it improves the quality of conventional research in terms of how social sciences are being practiced today. But most especially exciting is that it allows for a new model of integration of research and policy, and not just bringing those two together, but also bringing various methods of social science inquiry together. And I think that Peter had kind of raised these ideas yesterday, that this incorporates many methods, many materials, so not just data, but also the humans that underlie the data, and scales of operation, so both at our laptops and our computers and on the ground. So to pick a very zeitgeisty subject, this is 2013, Pankaj Gupta had Twitter on State of the Union 2014, so I'm a little behind. Obama had stated during the State of the Union, every dollar that we invest in high-quality early childhood education can save more than $7 later on by boosting graduation rates, reducing teen pregnancy, even reducing violent crime. And so this is a very powerful proposition to have numbers attached to this so that we get beyond this question of just social policy and redistribution for equity's sake, but more for social efficiency's sake. That here is a data-based, a data-driven rationale for making the investments in social policy that we do. So this did get a lot of buzz in Twitter. There is an interactive graph, but here's your infographic. I've circled that 19,000 tweets per minute that this statement happened to make. It was behind gun control and minimum wage in the speech, but there's a lot of buzz and power behind this idea. And so on the next slide, I'm going to show you the evidence of the biggest study on which this policy was predicated. And I know the researchers, I know them well. They do very powerful magic in terms of doing work from data. It is the Perry Preschool Project. And the Perry Preschool Project involved 123 treatments and controls, both. It was a disadvantaged minority population, so it was not nationally representative. It was drawn from a low-income community in Ypsilanti, Michigan. This was the high-scope program, which is now very ubiquitous, in part due to the Perry Preschool Project. But it was one program. It was in the early 1960s, and because it was initiated that early, that allowed for the long-term follow-up where we can see the arc of how this influences lifetime trajectories in terms of violent crimes in later life and pregnancy. So this is, when we're talking about social policy, we're talking about small data, but this is really small data. We can't go back in time to the 1960s to draw a bigger subsample, but there is policy relevance to this, and big time. We just saw 19,000 tweets per minute, right? So the policy relevance is there's reason to believe that there are big, long-run investments to pre-K. But we don't have to sit there and bemoan how small that is. So Head Start Impact Study. So this is another one of the big pieces of our research at play in pre-K. So this was a study that was undertaken by the Administration for Children and Families. It was under mandate by Congress. So in 1998, under the reauthorization of Head Start funding, Congress had said, hey, you guys have to be demonstrating the effectiveness and exactly what we're going to be getting for the data. So they harnessed their engines, and they got 5,000 youth that were randomized between Head Start and no Head Start, just meaning any other options that they may have available. Started in age 4. It was a 6-year study. They were tracked through 3rd grade, 23 states, 84 grantee and delegate agencies, so we're not cherry picking anything. And if you read the final report, here are the benefits. There's a randomized trial, so we've manipulated the exposure to this new policy regime that we want. So we're getting a causality. It's a nationally representative population. It's a large sample. There are many sites, and it's a comprehensive set of outcomes that is tailored to the nature of the intervention. And the conclusions are some short-term impacts on language literacy and health status, more benefits for children from high-risk households, minority youth, children with depressive symptoms. That's great. Here's the policy relevance, is if you are a nationwide decision maker and you're trying to defend this funding, then this offers you some traction. If you are anybody else, if you are not a federal decision maker, Head Start is not a thing. It sounds like a thing, but it's a federal pot of money. And so unlike how I can go to Burger King and I can order a Whopper, and the fidelity of implementation of producing this Whopper is relatively similar, when I get to Chicago, and the relevant policy question that I ask is, how do I improve the quality of and access to my programs? This study does nothing for me, neither in the scale, because I do not have nationally representative populations. I don't have the average implementation of a Head Start study, nor from one neighborhood to another or one program to another is the implementation or the quality the same. And so this is practice irrelevant research. And in terms of current models of social policy research, what it tends to offer in current academic models is you will have publications on a proof of usually new concept, a high standard of evidence for what worked in another context, although the comparability to a current context is not immediately apparent. You will have a static research object. So there's a phenomenal paper that gets published in 2014, but it does not update to 2015, nor will it until somebody can make academic hay from publishing a redo, which most people don't. And it's not the needs and what's working in your context. So let's get to what big data is. Definitionally, and what it does for social policy. And what I argue is that academic data is kind of a linchpin of a workhorse in terms of shining the lamppost onto where our keys are located, if you know the joke. So what administrative data offers us is a common measure on populations. So by dint of being systematically collected from one end of a municipality to another, it gives us commonly comparable measures on populations. It gives us large sample sizes, so in the social world, this does count as big data, so that we can wash away variation we can do the wheat and chaff, signal through the noise. There's a measure of all actors, so rather than these traditional models where I initiate a study and I define a cohort and I follow individuals across multiple years, but I know that they're enrolled or are not enrolled in Head Start. In administrative data, it is most typical to be able to find information on institutions. So I know the location of a given pre-K site, the neighborhood safety, the staff, their credentials, and so forth, that are elements that are related to the program quality. Administrative data sets are typically, not always, longitudinal, meaning that they follow the same individual across time so that we can connect early causes with later effects. And there are repeated measures for consecutive cohorts. So if I initiate a policy in 2014, I have measures of the kids who went through pre-K back to maybe 2000 and going forward ever after, so I can do a parallel comparison in populations. So administrative data is not just one thing. Chicago Public Schools has a certain breadth around the data that they collect, but there are probabilistic record linkage methodologies that allow you to link administrative data sets so that you can broaden the domain of measures that are brought to bear. Administrative data is passive, and here it's what's important about that is low-cost accumulation of data. So when I want to initiate a study, as I do at Chapin Hall, I don't go out and collect data. If I wanted to get 5,000 pre-K youth in the city of Chicago, I'll give you 20,000, and it's free to me as a researcher. Or there's no additional cost to collection. That information is already gathered, and we can immediately launch a study. And almost by definition, administrative data are aligned with the interests of policymakers because it was collected because it is the population that it is their custody to track, along with the measures that are most salient. So this is a model that I'm going to offer to you to coin a term. If there's anything you're going to tweet from this session, or at least my talk, it's in situ research. And I know that we're in a law school and everybody knows how to pronounce that. This is the Peter Shane Memorial YouTube pronunciation hyperlink, in case you're wondering. So here are the resources that I propose for research, and this is what I work with in my projects. So I use linked administrative data from the Chicago Public Schools, child welfare, both state and local, juvenile justice, and after school. And there are also links to adult corrections, welfare, Medicaid, and so forth. But so I'm even drawing a narrow circle. But more than just the data resources, we have relationships, which is a connection to stakeholding institutions, which is both nonprofits and public agencies, and also access to the populations of interest. And so to borrow from Kate Crawford's talk yesterday, data is people. And so in social policy, these people are out there, and you can shake their hands, and you can figure out what's going on with them. And I didn't quite get that. Tell me more. So here's step one. Non-experimental methods to examine patterns. And so this is the kind of arcane magic. My background is in economics, and we are versed in quantitative methods where we can't necessarily experiment and randomly assign states into different tax policy. And what this yields is a couple of things. It's an association between program attendance and youth gains for a range of youth outcomes, controlling for other factors so that we can separate non-associated explanations aside from programming by youth population, which reflects the full diversity of, for me, the city of Chicago. But there's uncertain causality and uncertain mechanisms. So from the data, I have a limited view. I have maybe 10,000 or 5,000 foot view, and I can say that this site is associated with gains that are larger than I would have expected based on the other data that I have in hand. If I have done arcane enough magic, then I can publish that in an economics journal, but that's not something that you can take to high stakes accountability. So what do? We can integrate qualitative methods following these associations. And so to borrow from a great concept that I got from Harvey Miller yesterday, this is abductive reasoning. So we go from data into hypothesis generation. And so qualitative methods that everybody derides as being small scale and not generalizable and not actionable, we can go to the sites and to the populations and say, what did we miss? We have these associations of particular gains, more than we would expect. So what have you done? Tell us about your practices, or tell us beyond that, what have we not measured? So is there cream skimming, or are you successfully targeting disadvantaged populations in ways that we cannot measure, and that we can expand our measures? So how do we make practical use of this knowledge? So let me recall the Head Start impact study. Randomized trials can be used within this context. And whereas they would take several $1 million for an implementation study to draft, recruit, take baseline measures, and follow study populations, we have the population measured. We have baseline data. We follow them costlessly through time. And so with coordination with public stakeholders, we can embed a randomized controlled trial to say, we think that these are best practices. So let's try them out in other areas, and let's follow that across time and see if that bears out. And what this gives you is not just a study, but also a policy practice itself. So this is evidence. This gives evidence for a particular model for a particular population in context. And so the last stage, repeat these steps. So there's no real step one, ultimately. That's just a clever ruse. This is a continual feedback mechanism in cooperation among academics in the city. And this gives you continual applied improvement as a policy itself, as well as generalizable knowledge as you need to maintain tenure. So who's helping at this stage? I should advertise that I'm very bullish about Chapin Hall as a particular institute, as a model of independent research center that's able to engage in these partnerships. So it is not a 24/7 disco party in the world of using administrative data. So there are important acknowledged limitations, but I think that this segues very well into a discussion to the extent that you have a taste for having it in the panel. So in the first place, we are beholden to a given sampling frame. So we don't initiate the study. We take the data as it is available. Just to highlight a couple of these limitations. The data quality may be poor or uneven. It depends on the taste of community-based organizations to enter data with high quality and with fidelity, although improving technology and databasing and front-end transactional databases can improve that, and also incentives. If I know that this is meaningful data, I may enter it with more care. The measures may not be research quality because we don't have a 200-item survey. The measures that we have are subject to feasibility and political pressures, but we can go back to the well and go back to these populations and do primary data collection. Very importantly, we have incomplete coverage for those not represented in public records. So undocumented populations are outside of the scope. So there is no particular view, and that is a population of particular consequence. Those using private services. Everybody in the Chicago Public Schools back to 1991, but I don't have parochial schools. Since we're in law school, just to give a note on permissions. So these are very closed data. So we have juvenile justice records, we have child abuse neglect records. So these data are identifiable and sensitive. Obtaining permissions requires a very careful review process. But this is, ultimately I can wait. But a limitation to engaging in this data is that I cannot open the doors, as Ashid had mentioned yesterday, as NIST does, to bring academics in for collaboration because they have to meet the gatekeeper. Other comments I'll leave to the panel, but I'm very excited to discuss some of this work. For now, I'll cede the floor to our colleague Scott. Thank you.
Is there anything that can be done about the amount of background hum that seems to be in the auditorium? Is it just, I hope it's not just my head.
No, I'm hearing that too.
Maybe not. Scott Burris.
Well, thanks. Like Mike, I'm very, like everybody, I'm very glad to be here and appreciative to Peter for giving me the opportunity to think about where law fits in big data. I need to explain first in the talk just exactly why a lawyer is here talking about big data, and not just that, but talking not in terms of regulating access or something like that, but actually talking from the position of a sort of social scientist, Monkey. And I'll say a little bit about that, and then I'm going to talk about, I think, the two very important ways from my work in health that big data seems to be an issue. So let me say a little bit, first of all, about context. Public health law as a field has been actually around for quite some time. For at least 100 years, you can go back and every now and then find some legal academic or practicing lawyer talking about public health law as the application of legal professional skills to helping people in public health solve the various problems they run into when they try and do public health. And so that might involve litigation or sort of lawyer-client representation or research, especially normative research, thinking of the normative frameworks and values of public health from a legal perspective. And there's actually a big problem with this model because it misses most of what happens in public health. Public health is a field that is run by health people, mostly doctors. The decisions about money, the decisions about policies to innovate with, decisions about what policies to favor, to enforce them, to implement them, to evaluate them, none of them are made by lawyers. Lawyers are a very marginal group in public health, and yet law is probably the most important single tool we now use to change behaviors and environments to promote health in society. It's been that way for at least 50 years, and even before that it was an extremely important tool. So there's this glaring absence of, you might say, ownership and consciousness and professional identification with law among the people who are the real people who do public health. And so in the last year or two, we've started to talk in our program about, and I think starting to talk more broadly in CDC and other organizations about what we call legal epidemiology, which is, has its own little definition, the scientific study of law as a factor in the causes and distribution and prevention or promotion of health in a population. And this actually is not that much different from other elements of the practice of public health. There's an ideological side, which is trying to understand how law as a social practice in a set of institutions is influencing the distribution and level of health in society. And there are a lot of ways in which law does that, even when it doesn't call itself health law. All you have to do is look at the association between imprisonment and incarceration rates and the health of people who are subject to incarceration and their families to see that, and that's a pertinent topic around here, given the research that's done at this school. Of course, as I've said, law is a very commonly used tool, and so understanding the implementation and effectiveness of legal tools in health is a classic public health research problem. We pass a seatbelt law, and we think that's going to be an important way to improve traffic safety. We need to actually monitor whether people wear seatbelts, and then whether when they crash, they die less. Likewise, if we're doing cancer control and we think smoking is a big cause of cancer and we're going to promote less smoking, we better know that those bans on smoking are actually influencing cancer rates or smoking rates. And that is a research question, not a lawyer question. It's a question for evaluation. And of course, if we're using law as a very important instrument of public health activity, if in some sense the enactment of policies is also a proxy measure for progress in public health action, then you'd think we should know how many laws have we actually passed, how many policies have actually been implemented, and we should know that not just at the national level, but at the state level, and in particular on things like obesity and smoking. What about the local level? We're actually making the biggest hit on obesity, not in any kind of national policy because we can't figure out one, but on things like competitive food policies at the school district level. So it seems like we ought to know how many school districts actually have those policies, and are we making progress? Are there more this year than last year? And we ought to have the data out of that tracking process to start to measure effectiveness. And that's what we have in that middle line there, policy surveillance. So I run a program that funds and otherwise tries to enable and support evaluation research in public health. And so one whole set of our questions about big data is how can we do a better job evaluating the health impact of legal interventions and of laws that were not meant to be legal interventions or health interventions but may be having big health effects. And there we run into the problem that I can summarize in 3 letters, NIH. In spite of the fact that law is this primary tool, the record of NIH in sponsoring not just specific studies to measure the impact of laws, but the development of a research infrastructure of people and measures and data sets and so on has been really not very good. It's been spotty. There's been some areas of excellence like traffic, alcohol control law, that sort of thing, the world of crashes. Cancer control, another area, really good development of everything you need from the data sets of law through the outcome data sets, through population survey questions that probe the risk behavior and so on. But pretty much that's it. Everything else, we're on our own. And so I'm not going to redo Nick's presentation, but it's exactly that we need. The fundamental problem of measuring the effects of something like law on health is that you don't get very far with law on one side and a health outcome on the other. You have to be able to postulate the mechanism of effect and then identify measures between those 2 points where you can begin to see change and measure change. So whether that's knowing how many tobacco billboards there are in a neighborhood, knowing how many traffic tickets are written, knowing how many prescriptions for opioids are issued in a particular place, we need that. And we need easy access to it because NIH is not giving out much money to do this research. My standard grant is $150,000. So if somebody's going to do a really meaningful study for me, they better be able to get some data and spend most of their time doing the analysis, because if they have to go out and measure how many people are using their cell phones while they drive, that'll take the entire $150,000, especially since they have to reinvent that wheel. We haven't necessarily had a standardized procedure developed through the kind of science infrastructure building stuff that NIH does. So that's all I really need to say about that. I mean, for us, the promise of big data is potentially a lot greater access to the kinds of things we could use to measure the immediate, intermediate, and longer-term effects of laws on behaviors and environments. And you can see from this overly elaborate the many places you could find things to measure. Because of the many ways law works. Implementation is a huge thing in and of itself and very important to measure, and of course varies across jurisdictions. And that implementation is going to affect environments, it's going to affect physical environments, it's going to affect normative environments, it's going to affect the behavior of others, and the behavior of others is going to affect individual behaviors and vice versa. This is going to structure vulnerability and resistance. And ultimately, at the end of a very long chain of pretty complicated events, substantial changes in health. And the world of big data, I'm hoping, is going to help us find things to measure in all those cells and make what we do much more efficient. The second thing, though, then this is where I felt a little bit more like, well, maybe this is big data and maybe it's not, depends what you mean by big data, is in this area of policy surveillance. Because you've heard a lot of people at this conference talk about policy, how important policy is. Law is clearly one of the strongest expressions of policy. And yet, go out and look on the web. Look for law as data. You will find only a handful of actual available research data sets full of law that's been coded into data form. You'll find lots and lots of 50-state surveys and things like that, most of which are on Word or in a PDF, most of which were done at some time in the past by means you will not know and cannot determine, and will be of varying levels of quality or even up-to-dateness. Early on in our work, decided we needed to help promote legal evaluation by raising the standard of the creation of legal data. And then as we were trying to sort of articulate what that standard was, we said, well, we better try and make some legal data sets. And then we found there was no software that was really designed for that and worked well for that. So then we built the software. And then we reached this point where we said, well, now we got digitized legal data on a web-based platform. We could publish this too. We could just let everybody see it. And that's when we started to have some, sort of so here this is a slide of the scientific process. You know it's scientific because you can't read it and it's really complicated. Essentially we're talking, the key insight, which I'll come back to in a minute, is to recognize that making a legal data set involves observation and not interpretation. Which is an obvious point for any scientist, but lawyers are trained from their earliest days in law school to efficiently mix observation and interpretation. So when they've read one thing, they've not only read it and seen how long it is and what it says, but they've also figured out what it means. And we've tried to take the what it means part out for this first layer of coding, descriptive coding, and then secondly, to understand that you have to have explicit protocols for quality control and doing the research and doing the coding so that scientists can trust this as having at least to be valid in reference to the data that we purport to represent. So we created this thing called the Workbench, which is at the moment the world's only software designed for coding law. And we get records that look like data. And this has been very useful for us. It's an interface that allows people to sort of have the text on one side, maximize sort of accuracy with your text and the questions you're going to code from. It's all together so that you minimize entry error and maximize efficiency. And a lot of this is about efficiency because it's the cost of doing this legal research that has been the big reason why the internet is riddled with long dead, unupdated data sets. And doing it this way also allows very quick updating. And it then allows you to layer data over time, so you start to be able to say, well, this was the first state that had a distracted driving law, and then, next row of data, you might say, next year we have more, and next year we have more, and next year we have more. And, download the data if you want to check that yourself. But this is where, we start, I'm going to get to my conclusion, which is this really about big data? Because, in some ways it is, and in some ways, I've thought of it as the 97-pound weakling on Big Data Beach. I've thought of it as either the coolest thing that ever was or the biggest liar that ever lived. Take your pick for the metaphor. They're both sort of media metaphors for older folk. So if you don't get it, ask your gramps. But not big or big. The funny thing is that the machines can't do this. There have been some attempts to code statutory data using machine learning, and they haven't cracked it yet, and I don't know if they will because it's pretty efficient to do it with humans. And again, statutes are not that big. You know, that you can hear words like there's 195,000 new statutes passed every year, but there's not that many that people care about. A lot of statutes are the state bird and the declaration of, you know, this is National State Bird Week. You know, they're not all that important. They're ultimately kind of finite. And once you've coded them, a lot of your work is done, and subsequent changes are actually very marginal cost to add. And, you know, I say another thing that sort of makes this not big is that, you know, it seems very reductivist and almost anti-interpretational in that, from a lawyer point of view, in that we're just trying to say who's covered, what's the prescribed behavior, what's the procedure for enforcement, and try, you know, it's what the law says, it's not what it means. You know, we're taking a very limited view. But what makes it possibly big? I mean, the first thing is, again, this is the only game in town. I don't know of any other way, or really too many other people who are coding law this way. And it's only this way. It's only by digitizing law, by turning law into numbers, that you can actually get it into the dataverse. You know, all that law out there that's electronic, that's sitting in Westlaw or Lexis or on the web, try and do something with it. You know, it's not data. It's just a huge pile of information. Some people can do some things with it, and I'm not saying that you can't, and there's lots of great ways to analyze it and get at it, organize it better, but it's not something that you could add to a depiction of school policies, school education, or school outcomes. There's just so many people who could potentially use legal data once it's coded. You know, you can turn this into apps, so people could, you know, human beings could have their own state's law, or, you know, some kind of law, say the building code or the fire code, if you're an inspector or a contractor, just on an app. It can be layered on all sorts of other people's data to help provide some context, you know, at least to do some initial mashups between why we have certain healthy places and unhealthy places. I mean, we can see, for example, one county has used our system to code their smoke-free policies in parks and schools and so on. And it turns out that institutions with smoke-free policies are all in the rich parts of the county, and poor parts of the county don't have any of those. So right away, I mean, that's actionable and informative even without doing any further analysis. And I suppose most importantly, and this sort of turns to the legal profession, everybody's telling lawyers that their business model is dead and that they have to stop being vertically integrated firms that do everything themselves, and they have to outsource the cheapest provider. But how do you do that? That's not so clear. This is the only thing I've run into where you can actually outsource research, because that initial level of coding produces answers, not organized legal data. If you want to know which states have laws that ban 18-year-olds from texting, you just click one button and you find that answer and you see that law. It's not giving you information to plumb through yourself. So that's kind of interesting. And of course, once it's done forever. No lawyer ever has to ask that question again, which seems like it ought to be something big. Although whether it's commercially big or socially big, I don't know. But I do know that we measure so much and do so much with policy, and you can say all you want about gridlock. States are passing lots and lots of laws in health. Nowadays the adoption curves are like this. Stuff spreads really rapidly. Within a couple of years, you go from 0 to 50 states. It's bipartisan, it's popular in the public. There is no, you can talk about the nanny state till the cows come home. People are demanding that government do things to stop things that clearly threaten them, and legislators are happy to do it. So it's a big, big area, and we want to do it right, and we want to make sure it's done fairly so that everybody is exposed who needs it. And I don't know where you start if you don't have the capability to tell people in real time, well, who's done what? And to create the data that allows us to evaluate it quickly. So, big data is more and less than a big spreadsheet. I think what makes data big, and what I'm taking from this conference, is the relationship between the amount of information, the range of information, the accessibility of the information, and the potential of the information to actually be used to do something good. If you get all those things together, then I think you have big data. Otherwise, you just have, frustration.
Thank you. So again, we have some time for questions. He was hopping to his seat.
Neil Hooker in the Glen School. Question for Scott. From what I understand about an implementation issue and an interpretation or jurisprudence issue, there's a continuing role for analysis way past just the statute. So the interpretation of by courts, how would you see that extra layer being added in?
Well, at the moment, we sort of see that's somebody else's job. Right? I mean, in a certain sense, it's not, statutes are much easier and more finite than cases. And the task, and cases are also something that people go to, generally speaking, when they have an actual dispute and the facts are narrow and they're looking for something that's quite relevant to that particular scenario. Whereas statutes tend to start, at least, with the idea of producing a general rule for everybody. Now, what that rule turns out to be in a particular instance is different. So we see and generally speaking in the history of evaluation work, most of the time, cases have not played a big role in establishing that left side variable because, you know, it's true that you could probably find a situation in which there's a real question as to how the seatbelt law applies. But in 99.999% of cases, the seatbelt law's application is entirely clear. So cases don't tend to be that important. I think that there's a lot of the future has to do with whether we can bring the benefits of computation to legal analysis. You know, law professors were way ahead of everybody in getting electronic material to their desks and putting all their core texts electronically, and then they stopped. So when you're a lawyer now, you get the state-of-the-art delivery of information, and then you pull out a yellow legal pad or the Microsoft equivalent, and you type like you were in the 19th century. One of the things that can happen with coded legal data, if it's, you know, assuming it's coded properly, is that you can potentially start to create algorithms that would allow you to do computational analysis. You know, if A is true and B is true and C is true, then that law means D. And maybe that could develop somewhere, and you might start to see that influencing law practice, and maybe it would get back to the sort of the world of interpretation and judges. But I think that's something that's going to have to unfold over a much longer period of time.
So can I ask, Nick, you and Scott were really talking about, you know, mobilizing data in a way that would influence policy. And Michael, I think you were talking about information that would be usable by organizations in their decision making. We haven't really focused on what I think are various projects that go on that try to influence individual decision making. And I guess I'm thinking in the schools context of various attempts to put data online that allow people to, you know, grade their schools or rate their schools. And this may also be useful to policymakers, to be sure, but the thought would be, you know, if I know these data about how certain kinds of foods affect health, then that would affect my personal health, my personal food consumption decision making, or, you know, if I know that there are certain outputs at a particular school, I know whether my kids should go to that school or some other school. I confess I'm generally dubious of the tools that I've seen like that, and I'm wondering whether, you know, there's just a difference in the kind of level of attention that is devoted to the quality of data when it's aimed at organizations and policymakers versus when people create these tools that purport to be of use to, you know, the clients of these agencies or consumers of public goods. Is that an answerable question?
I'll jump in and I'll give a little bit of interpretation on that. So I live on the south side of Chicago. We have a very well-known community organizer. And I think that, you know, there is an interface between you know, the public themselves and then the institutions, you know, that they are related to. You know, so this is a particular type of, you know, individual action in terms of, say, enrolling my youth in a pre-K program. Yeah, so I think that, you know, that there's, you know, in the direction of what I was suggesting, I think that there is an interface where, you know, whereas a lot of like the policy systems are, you know, are we having an impact when we have enough contextual data, so where are their modes of transportation? Online information is ubiquitous, but when we're talking about neighborhood programs, we have information about neighborhood safety, transportation networks, catchment areas, and administrative boundaries. We know in many cases at the residential locations of where people are or are not being engaged. And there's also a conversation that can be had back with organizations. And so I work with a number of CBOs to do sort of an impact study of engagement. To say, relative, based on residential patterns and the local demographics, here is who we would expect to be utilizing public facilities, and here's sites that are doing well and who they're missing, and when you can start to initiate that conversation, it's less, the information is out there on the web, and more, that those. Community-based organizations may understand outreach and human behavior. Are we posting in a laundromat? Having data on that scale back to CBOs kind of operationalizes engagement, because their instincts as local agencies, it covers program locators like the City of Boston, City of Chicago have for funding after-school programs, but also like the much more nuanced, much more like in-person analog tech.
Yeah, so I could maybe answer your question this way. Well, first I ask myself, well, what kinds of individual decisions do you have in mind? So some decisions that I could imagine an individual in a community making might be something like, I'm looking for a house, I'm looking for an apartment to rent, or I'm looking for a house to buy for my family, or if I'm a commercial operator, I'm looking for an investment opportunity, maybe a foreclosed unit. I want to renovate and redevelop it. Where are the good ones? Maybe I want to start a business, and I need to know sort of where is the best location for this business. Or I want to choose the best after-school program for my child. Or maybe if you have a local beat cop, you want to communicate with the police department, where should this beat cop concentrate his or her time? So these are interesting individual decision questions that in principle can be addressed through publicly available data. And I think that there's work out there on community geographic information systems. Different researchers have worked with community organizations to develop customized spatial data sets that incorporate qualitative and quantitative data and develop customized applications that allow ordinary residents with no special expertise to do queries to answer these kinds of questions. So yeah, there are applications out there that can use potentially large, diverse data sets to help people answer individual decisions.
On the law front in health, obesity is a good example. This ought to be studied, but a lot of people in public health believe that law has been important in starting what appears to be something of a turn in childhood BMI. And it's not exactly because we passed a lot of stringent laws. It may, in fact, the suspicion is that it's because people just wouldn't shut up about obesity, and it was all over the papers. We're going to pass this law, not pass this law. Is Mayor Bloomberg a nanny? Should we have this? Should we not have it? Menu labeling. And that raised consciousness in a way that then led people to make their own decisions because this was now a salient factor and information was reaching them. And I think that's the way that law often works, much more by information. On the other hand, like our particular thing, today I'm sitting out there during one of the panels. I admit I checked my email, and an email from a guy who's working on legislation in Kentucky on the drug overdose issue. That there's been a cascade of legislation on that since Philip Seymour Hoffman died. This guy said, can anybody tell me, give me some language on standing orders for physician prescription of naloxone? And all I had to do is point him to the website and say, go to the button that says, which states authorize standing orders, click the button, and then any one of those states, you'll see the 9 or 10 states that do it, and you can look at the language. That's just a rapid way to spread legal innovation at times when people are in a hurry.
Do we know yet if those laws are having an impact?
No. And this is, so when you talk about big data, it's not legal. That's one of the key things to understand, I think, about this, breaking down the silos and trying to think of big data across things. I mean, the first thing is, as Scott's group told us last year, there's not a very good system of coroners and medical examiners doing rigorous tox screens on a regular basis, so we don't even have good outcome data, which is somewhat rare in terms of what killed people in something that's this big. But then moving on from there, who's getting prescriptions, who's prescribing, all that kind of stuff. I mean, it's a huge bunch of questions, and access to data is crucial to understanding that.
Yes.
Howdy. I don't have any research on this, but my impression is, on the last question that you just asked, that we don't have a lot of experience on the opiate laws yet, because the states have really only come to realize that it's a huge problem, starting with Kentucky and a couple others, and the best practices for these kinds of laws have just really been distributed, so it's all really going on right now. I came up, though, to, and I'm not sure if I can make this a useful question or not in terms of what we're talking about, but I wanted to thank particularly Mr. Burris for putting the larger view of how the law is integrated into this before us, and talk about all the useful things, the opiates, the distracted driving. I see, however, it's easy enough to talk about the majesty of the law sitting in a law school, but if you consider lawmaking as a competition among pressure groups to try to get their favorite thing done, sometimes there are pernicious influences, one of which I'm going to mention in a minute and ask for your comment. A state legislature doesn't necessarily have any special expertise to decide if an orthopod or a podiatrist is allowed to work on the human foot. But sometimes these questions come up there and they decide they're going to make laws about it. The thing I was going to mention in particular is the e-cigarettes. All the research shows that you can impact favorably health outcomes with these things. You don't have the health effects. You certainly have the addiction still, but you don't have the heart disease, you don't have the cancers, you don't have any of those things. Yet, the law is moving to frustrate the use of these cigarettes, and I was going to ask for a quick comment about that.
Well, that's a great one. I mean, just on that particular question, this is a wonderful cultural problem. I came out working on HIV. I came out, and working with drug use and syringe exchange, I came out of a harm reduction approach, which was if we can implement measures that will allow people who won't stop doing the thing to do it more safely, that's a good thing. Remarkably enough, a lot of anti-tobacco campaigners came out of this thing where we can wipe out this behavior, and seeing nicotine as a dangerous drug that there should be 100% prohibition of, consciously or unconsciously. And so now the e-cigarette presented them with a harm reduction opportunity, and they were not sure harm reduction was a good idea. That was one thing. Now, of course, the second thing, and this is actually a researchable question, is this just a big game to get people to keep smoking, get hooked on nicotine, and then move to a cheaper delivery device, aka the cigarette? And to me, that is the ultimate public health question, which we got to figure out. We may have some people who are prematurely deciding that the harm reduction approach won't work, but it's certainly an important question.
So, oh, yes, okay.
I should come up earlier.
That's okay.
So, Lisa Frazier, I'm here at the Glenn School, and I actually do my research on public health policy. My background is in epidemiology. And my question is sort of a bigger conceptual question, which is that yesterday we talked a lot about what I would term social data, right? Social behaviors, the behavior of humans as social beings. And the three of you are really talking about mind, body, and soul, and things that are a little harder to track, or we're less comfortable tracking in big data ways. So I was wondering if you have thoughts about how we might sort of step back from the notion of big data as a computational sort of informatics technological baseline and think about data. Data is really just sort of bits of information. So how can we think about what's represented in our minds, our bodies, our souls as information that is not necessarily technological data bits in nature, but rather in sort of softer data forms, more qualitative forms of big data, and sort of conceptually what that looks like?
It's a great question.
Right. Thank you for your question. So this is something that I've thought about in various aspects of my research in housing and community development. And the question is really fundamentally to an organization that does work in the community, what matters to our organization? What goals do we wish to achieve? What are our fundamental values? Organizations, these mission-driven organizations have missions. They're founded by people with passion. But sometimes it can be difficult for them to articulate why they're doing what they're doing and how they can distinguish between the problem that they're given and the problem they want to solve that's more closely aligned with their fundamental objectives. Well, there are methodologies out there that allow organizations to distinguish between these means goals and these ends goals, and by doing so, identify attributes of their objectives they care about that allow them to measure how well they're doing. And these attributes can be used to help them identify decision opportunities. There are probably different names for these methods, but one that I'm familiar with is developed by a decision theorist named Ralph Keeney. It's called value-focused thinking. And it is an interactive, qualitative method that allows you to, in a sense, structure decision problems. But of interest to this audience, it allows you to identify the variables that are most important to particular organizations that allow them to figure out how what they're doing can make a difference, what story they're telling. So yes, there is a qualitative approach to capturing these value issues.
I think we're actually at the end of the hour, so I'm going to let Michael have that last word, in part because it's inspiring just to know that, in terms of the big data future, there are approaches that could actually help this information be deployed on behalf of human welfare of all kinds, which is a good way to end the panel. So thank you very much. We're going to take 15 minutes. We're going to reconvene at 3:10, which is sort of an odd time, but we'll reconvene at 3:10. We're going to have a panel that's going to talk about big data and the future of cities, followed immediately by a lecture on data visualization and the urban future. So please rejoin us at 3:10.